Hello, and thanks for watching. I'm Susan Checkow-Lusignan, Director of Marketing and Program Development for the Friends and Foundation of the Rochester Public Library. FFRPL is the 501c3 charity that raises funds, presents programs, supports special projects, helps to create specialized spaces, and purchases equipment and supplemental materials for the Rochester Public Library. Learn more at ffrpl.org. We are delighted to present this installment of the virtual version of our Fall 2020 Books Sandwiched In series of book reviews. As many of you know, Books Sandwiched In has been running continuously since 1956. We'd like to thank all of our reviewers who are participating remotely this season, and we look forward to welcoming everyone back to the library when it is safe and healthy for staff, reviewers, and the public. Our fall BSI roster focuses on diversity and inclusion. Today's presentation will be a review of The End of October by Pulitzer Prize-winning author Lawrence Wright. Wright says that although his new novel has been described as a kind of prophecy, he sees it as simply the result of careful research. With uncanny prescience, he outlines a terrifying vision of how a modern disease could capsize society worldwide. While our thoughts turn naturally to COVID-19, there are many similarities between this current pandemic and that of HIV, including the perception and community valuation of high-risk groups, and heated public discussions on public health policies, ethics, and personal privacy issues. Our presenter today is Dr. Bill Valenti, co-founder, staff physician, and senior vice president of strategic advancement at Trillium Health, formerly the Community Health Network. Dr. Valenti has dedicated his life and career to ending the HIV/AIDS epidemic and has rightfully earned his reputation as a pioneer in HIV treatment, prevention, research, and policy. Dr. Valenti is a clinical associate professor of medicine in infectious diseases at the University of Rochester School of Medicine and Dentistry. He serves as chair of the Infectious Diseases Committee of the Medical Society of the State of New York and is a 2013 recipient of the Linda Laubenstein Award for Clinical Excellence from the New York State Department of Health. Most recently, Dr. Valenti has served as co-chair of the CARE Committee on the New York State Health Department's task force to end the HIV epidemic by 2020.
Tilde, trusted comrade. Wright paints her as having a dark side, and I'm sure she did. Need that to get ahead. I kind of see her as every organization's institutional memory, the kind of person that you can connect with. We sometimes meet those people, connect with them, you can talk to them, meet with them, tell them your deepest, darkest secrets, trust them, you can trust them. She seems to be in the know. I like the institutional memory piece because that's important. You know, you got to understand the history of organizations and programs in order to keep them moving and move them successfully. So I was glad to see Tilde moving in and out of here. Matilda Nichinsky was her name. Wright also weaves together a variety of anecdotes that are really authentic, that are really things that happen when you're investigating an outbreak, trying to make sense of these kinds of new, unexpected events. There's a lot of movement of people in this story and in real-life events in terms of understanding pandemics, how to manage them. They talk about Ramadan here in the case of MERS, the pilgrimage to Mecca as another event where large numbers of people come together and spread virus. Those are super spreader events, and one of the key events in the beginning of the COVID pandemic was the Chinese New Year in Wuhan, China, where millions of people were traveling and leaving Wuhan, coming into Wuhan to visit with family during the holidays. So those are real life kinds of activities that contribute to spread of a virus, and there was a fair amount of it going on before we became aware of that first case. It was on New Year's Eve, December 31st, 2019. There's also a discussion in here about patient 0 and the first patient, trying to, again, characterize the epidemic, the pandemic. And they talk about patient 0. Remember the blue lady as patient 0? Well, she really wasn't patient 0. She wasn't the first. You never really know who the first patient is. It's just hard to figure that out. My point is that long before you identify the first case, there are other scattered cases going on that you may or may not learn about as you go through this investigation and through this process of sorting out fact from fiction. So that's just an interesting point that needs to be made here. So wisdom and leadership are really critical to the effort. Wisdom, leadership, experience also are important here, that if you've never done this before, you're highly likely to, or almost certain, to make mistakes and it seems like the tendency here among leaders of various countries is to downplay the importance and the seriousness of this. We have certainly seen this in the United States with our president. I mean, just totally downplaying the importance of this, realigning the message with the scientists, diluting out the scientists' opinions. But it's not just in the United States. Getting back to the book, in the royal court, Saudi Arabia, the Saudi prince exclaims, "But it's the flu. It's the flu." We really need to get away from it's just the flu, because COVID is in no way the flu. This was the flu, but this was the super flu. Remember, this is some sort of mutated or rearranged influenza virus that has this Ebola-like component to it. So it's really more than just the flu. These responses that Scrutiny issue do nothing for individual or community health. And remember that this is a global activity here, so that you have to get it right, and the best way to do it is to listen to your advisors and people who know and have experience with these kinds of things. So book 2 or section 2 deals with the economic impact of this pandemic. Remember the animals. Mr. Stevenson's turkey farm was quite an epic in terms of just the impact on one person. Just the impact on one person and family and region But those kinds of things are global when it comes to slaughtering animals and dealing with the economic fallout after that. So when you talk about closing down a country, closing borders, and limiting commerce and travel, as we've seen, I mean, this is really serious business. So you've got to get it right. And the inept vice president in this narrative is a perfect example of that. I mean, he just didn't know what he was doing. And you've got to listen to people like Tony Fauci, Dr. Deborah Birx, Dr. Henry Parsons. The president needed to do more than just spend time on his tanning bed and provide leadership. There's a pandemic out there, and we just need to get it right. Isolation is the separation of sick people. Sick people go into isolation and restricted activity, limited contact with other people, generally for 14 days. In the case of COVID, that's the long incubation period, so the 14-day rule holds there. The definition of quarantine is separation of healthy people who are at risk of developing disease, usually because they've been exposed. So the differences, there are differences between isolation, separation of sick people, versus quarantine, which is the separation of exposed people. So that's that difference. There's also some discussion in Book 3 about what's going on at home and the goings-on with his family and Mrs. Hernandez and her activities. But you know, it's just getting a little darker in terms of the story. Speculation continues, well, it's a Russian virus because the Russians have immunity and have a vaccine for it. That's a very common pop conspiracy, is that people set these agents loose because they have either a treatment or a vaccine for it and want to exploit the global threat and make a lot of money. I mean, people have certainly exploited this and made money, but there's never been a case that documented where there's a cure for something that has quote unquote been made in the laboratory and set loose. So that's really, that still falls in the conspiracy category for me. And as I said earlier, I'm not a big conspiracy person, but there's something about the sounds of the this virus that just seems a little funny. The other thing I liked about the submarine part was the studying of virus that Dr. Henry uses some of his laboratory experience to begin to try and find a treatment or a cure. Remember the part about microwaving nasal secretions and swabbing the noses of the uninfected people on the submarine with the dried nasal secretions from somebody who was sick? And the idea is that nasal immunity would kick in. That's the basis for the inhaled flu vaccine that's used in young people. Is the nose is a great protector and makes a lot of protective proteins, antibodies, in response to being challenged with infectious agents. In the case of COVID, the nose, nasal mucosa, or the lining of the nose, is where a lot of COVID lands and attaches to tissue and sets up infection. So the nose is an important part of the story. So I was thinking of a couple things. One is the age of discovery with AIDS, during the AIDS era, when I was a young infectious diseases physician at Strong Memorial Hospital, and one of my medical students who became a professor of pathology and I would meet. After he was my medical student, he went on to join the staff and was a staff pathologist, a very bright guy named Dr. Mark Stoller. And he invented a quick test to make the diagnosis of pneumocystis pneumonia from coughed sputum. Prior to that, you had to have lung tissue biopsy in order to establish the diagnosis. And during our era of discovery, just the back and forth and thinking about this and talking about these things, and we would sit in the dark and looking in his microscope every afternoon at 4 o'clock, where we would review cases and talked about the need for something better and faster that would help patients with this pneumocystis pneumonia to identify that they had it, number one, diagnose it, and then do the appropriate treatment. So we've had a lot of those things. My partner in the startup of Community Health Network, the AIDS program, in the 1980s, Dr. Steve Scheibel, also had a small laboratory in the back of Community Health Network and was experimenting with developing a vaccine for HIV in those early days. So there's a lot of that. They also talk about some history. The book is really very well researched in terms of the historical basis that is here as a part of the story, and also the science is really very, very accurate. It's very intelligently written, I must say. Did a nice job, and talks about the challenge trial, which we're going to hear more about as the COVID vaccine comes online. But they talk about Dr. Edward Jenner in the 1700s with his smallpox work, where he would use the cowpox as a way of vaccinating people against smallpox, cowpox just being a less aggressive virus from the same family, and used it to prevent smallpox as a smallpox vaccine. And then challenged those people who had received the vaccine with cowpox to see if they got sick. Challenge trials. So be on the lookout for challenge trials. A great discussion with Commander Barker on the submarine between Dr. Henry Parsons and Commander Barker. And they're talking about the influenza season, and they talk about the virus returning in the fall. Commander Barker says, well, you keep saying that's why it must be returned, and Henry says, that's what influenza does. Great line. I've used that line thousands of times over the years. In other words, that's the way viruses behave. Can you explain this for me? Why does the viruses, influenza, for example, come in the fall, and why might it return, or why do you see low levels of infection with COVID in places, even though some places like New York have brought it under control? Why do you continue to see this low-level activity? And the best answer for now is that's just the way viruses behave. That's just the way it is. So there are some fundamentals here that we have to accept in order to move on and advance. Are you ready for book 4? Book 4 is called October. And my hunch was right that it does get darker. This is pretty dark. It's almost as though this chapter provides the fodder for believing in conspiracies. It is just really troubling. It's not just that there isn't any internet, there's hardly any civilization, that it's in disarray or even collapsed. And the descriptions of Henry returning to Atlanta to get reconnected to his family are very sobering. The ride to get to his house, taken on a plane to Atlanta, and then tries to get to his house. And, I'm just saying that the virus went out here. And I think a lot of it just falls back to really, really terrible, terrible absence of leadership, clarity, direction, structure. Then they go back and talk about the 1918 flu epidemic, kind of interesting, about how people tried to purge it from their consciousness, purge the episode from their memories, and therefore from history. It is a footnote in our history, but keeps coming back as we try to understand and deal with COVID. Reminds me of the chaos of the early days of the AIDS epidemic. One of our nurses described the situation as being like a war zone. So there was death everywhere. And we didn't have time to mourn because we needed to get back to work. The other sobering thing is the approach to death, attitudes toward death. No ceremony, with bodies everywhere. Remember the refrigerated trucks outside New York City hospitals at the worst of COVID? I mean, this is, in end of October, is even more sobering, with bodies just left to rot in their beds or buried unceremoniously in the backyard. At least his daughter had the decency to put a helmet on her mother as she dragged her out of the house and into the yard to bury her. We didn't have time to mourn. We needed to get back to work. In this case, survival was what they needed to get back to. Henry said it. I like this. It's sobering. I mean, I wouldn't want to be in a situation like this. Humanity once again sleepwalking toward a pointless civilization annihilating conflict. And another great pandemic, randomly mowing down populations with industrial efficiency. Wow. That's a statement. And on top of that, when he got back to CDC, his ID was no longer valid. Things had changed. So Wright gives us a warning to get with it, to wake up, to stop sleepwalking. Toward the end, talks about Putin killing our access. Get some leadership, direction, and clarity with getting this under control, and avoid annihilating your civilization. Brings Putin back into it. Putin killed our assets, and we are blind. It's like the prelude that he mentioned much earlier in the story. So it doesn't matter if the virus was engineered and created in the laboratory or is a biological event. The idea is to, remember I said earlier, this idea of getting ahead of the virus. And in the end, don't let what happened to the October civilization happen to us. Thank you.